歡迎大家出席今日。
Welcome to the press briefing. We have Dr. Chuang Chuk Kwan, Head of Communicable Disease Branch of the Center for Health Protection, and Dr. Gladys Leung, Chief Manager of the Hospital Authority. The two doctors will give you an update on the number of confirmed cases and on the hospital situation. First, Dr. Chuang. Good afternoon. Yesterday, there are a total of 2,856 positive cases. 948 are PRC positive cases, and the other 1,908 cases are the RAT positive cases, which have been successfully registered on the platform. And there are 172 imported cases, 149 are PCR positive cases, and another 23 are RAT positive cases. In total, in the fifth wave, we have 1.249491 million confirmed cases. The hospital authority reported an additional death case. In the fifth wave, there are 9,116 death cases reported, and including other cases, so 9,194 cases. That includes 3,799 males and 5,395 female male death cases. The hospital authority will give you an update too. Now, 861 confirmed patients are now in hospitals. 134 are newly confirmed cases. For patients who are in isolation facilities, 324 are in isolation wards, 15 patients are in the Tier 2 isolation facilities, 272 are in the North Lantau Hospital, Hong Kong Infection Control Center. In total, 99 cases are new cases. Yesterday, we reported 2 critical cases. There are no newly reported serious cases. Among the patients in hospitals, 12 are in critical condition, 15 in serious condition. For one of the critical patients, the patient is receiving intensive care treatment. And there's report of one death case, a 79-year-old female. She was taken care of by a helper at home. She is not mobile, and she's not been infected. And she had rheumatoid arthritis and apnea. And then because she didn't have a good appetite, she was admitted to hospital for a treatment and examination. Her emission screening was positive, and then there were signs of a lung infection, and then there was failure of multiple organs, so she passed away yesterday. Among the 172 imported cases, 98 cases identified at the airport through testing samples. 57% of the new number of cases. 57 cases are identified in quarantine hotels, and 70 cases involve people who've left a quarantine hotel, but the CD value is relatively high, so it's possible these are positive cases. Among the 172 imported cases, 49 cases involved arrivals from the UK, 15 arrivals from Singapore, 13 arrivals from the US, and 10 arrivals from France. And there are less than 10 cases involving arrivals from other places. For residential care homes, there are 2 today. Residential care homes for the disabled and the residential care home for the elderly, which have reported cases. For the RCHE is King Folk Care and Attention Home. There are 2 residents and 1 staff members who've become confirmed cases at different times. And in the whole home, there are 21 residents that need to be quarantined. Another is the Hong Chi Oi Tung Hostel for the disabled. There's 1 resident who's a confirmed case, and that resident went to a Siu Taiwan shelter workshop. A few days ago, there was a staff member who was a confirmed case at that workshop. So we have issued a compulsory testing notice on those who visited the shelter workshop. And then for other close contacts of the hostel, they have to be quarantined. For schools, there are 201 positive cases reported by 188 schools. For the 201 cases, they include 163 students and 38 school and teaching staff. They are from 49 kindergartens, 66 primary schools, 62 secondary schools, and 3 special schools. In the past week, 180 schools have reported 2 or more confirmed cases for the same school. So today we have recommended that 2 schools need to suspend some of the classes. One is the Nan kindergarten in Aberdeen, class K3UKB. There are 10 students there. 2 are confirmed cases. So we recommend that for this particular class, it should be suspended for a week. And the other is Manshan Primary School, Lingliang Primary School in Leon Estate, Manshan, class 60. 29 students are involved, 3 students confirmed cases. So we propose also class suspension for this particular class for a week. And then for the mutant variant strains, we have seen more cases. For BA 2.12.1, there are 42 suspected cases, including 28 untraceable cases and 14 cases linked to other cases. For BA 0.4 and BA 0.5, there are 17 suspected cases, including related cases. 13 cases are related to other cases, and for 2 cases, we could not yet identify or trace the source of infection, and there are 2 close contacts related to these 2 cases. For these 2 cases, one of the lives at Lingbok Shu Estate, the other lives at Shao K1. The household of 3 members are all confirmed cases. For BA 0.4 or BA 0.5 variant strain, it seems that we are seeing an increase in the number of cases. And for the latest WHO figures, we see that for BA 0.5, is replacing other variant strains. It's now found in 83 countries around the world. And then last week, the percentage was 37. Now it's gone up to 52% for BA 0.5 cases. For BA 0.4, there's also an increase in the number of cases, but it's not as much. There's an increase from 11% to 12%. For BA 0.2 and BA 2.1, 2.1, we're seeing a decreasing trend. For BA 2.1, 2.1, it's dropped from 16% to 9%, and so on. So we will closely monitor the situation in Hong Kong to see whether the trend is similar to that in other countries. WHO has stated that for BA 0.5, there is no evidence as yet to show that there are more number of cases or the symptoms are becoming more serious. But because there are more number of cases involving BA 0.5, so that's why the percentage would go up even if the number of cases remains the same. So it's a case involving those who are hospitalized or in ICU or those who pass away. So there's an increase in number of cases in this respect. And so if you don't feel well, you must see the doctor as soon as possible. Even if your RAT test result is negative, you should go and see a doctor and take a test to play safe. So that's all from me. Thank you. In the past day, 99 patients have recovered, 86 patients have been discharged. Since the start of the 5th wave, 52,507 patients have recovered, including 52,210 patients who have been discharged. Since early 2020, 64,887 patients have recovered. Of those, 64,590 patients have been discharged, and 1 patient was identified through admission screening. 2 patients in the same ward are listed as close contacts. As for staff members, there are an additional 40 staff members who've become confirmed cases. So in total, 24,632 staff members were infected. Another 30 staff members have returned to work. So in total, 24,314 patients have returned to work. I would like to make 2 announcements today. First, for Alice Nederso Hospital, In the medicine ward and the mixed ward, there's a male patient who tested positive on admission on the 4th of July. The hospital conducted contact tracing. They found that there are 6 patients in the same ward and 1 nurse who become infected. And out of the 5 patients, 5 of the patients are receiving treatment in isolation. The other patients have actually been discharged and are under home isolation. For all the patients, they are in stable condition. And for the nurse involved, the nurse is also under home isolation. Again, she is in stable condition. For this particular ward, is not taking any more new patients, and it stopped visitation arrangement. And then there's also thorough disinfection. The hospital will closely monitor the health condition of the patients and the nurse, and then we will keep in close communication with the Center for Health Protection. As for the Buddha Hospital, there are 2 more new male patients who've been infected. They are aged 40 and 51 respectively. They are in stable condition, and they've been transferred to the Wong Tai Sin Hospital for treatment in isolation. So far, there's 12 patients and 4 staff members have been infected, and the reference ward has been thoroughly disinfected. The infection control team is still tracing the links of these various cases, and they will follow up with the Center for Health Protection on the latest situation. Now, I would like to remind the public, because there are many more confirmed cases in the community, and many of which are untraceable cases. Now, since early June to now, in early June actually, we have a record low of the number of patients that is doubled by now. So we see that the epidemic is seeing an upsurge, so we need to remain cautious. The hospital authority is closely monitoring the development of the epidemic, and we will tie in with the infection control measures of the government to deal with this upsurge. And then we are fully prepared too in terms of our hospital services and facilities. We hope patients will cooperate with us. Today we would like to ask your cooperation on 2 issues. One, for patients who have not completed vaccination, please get vaccinated as soon as possible. You could then give yourself and your family members protection, especially we're talking about the elderly, the chronically ill, and the young. And as Dr. Chong Chuk Kwon mentioned, if you feel unwell, even if the symptoms are mild, we would recommend that you see a doctor as soon as possible and take a test. If the test result is positive, then you must declare your case, so you could receive proper treatment and follow the isolation arrangement. You must follow the instructions. You must not leave your home so as to reduce the risk of infection in the community. Now, please note that we are now in a critical stage in our fight against the epidemic, so please be prepared. If the epidemic worsens, then public hospital services will be affected in some way. So please work together with us so we could keep the epidemic under control. Thank you.
Now it's time for questions. Please raise your hands and wait for the mic and identify the organization you represent. Last but one row, the lady over there. Doctors, now TV. The airline circuit breaker system has been suspended. What considerations were there? Aren't you worried that there would be a surge in the number of imported cases, in particular BA.4 and BA.5 cases, leading to an outbreak in the community? Now, with this suspension of circuit breaker system, how many flights have benefited from that, and where are they from? My last question is for the HA. Now, with this suspension of circuit breaker system, are you worried that the hospital admission will surge, and what contingency measures do you have? Right, the government has published a press release explaining the rationale behind that. Simply put, the circuit breaker system has not been really played a significant role in guarding against the cases, and this might disrupt people's itinerary, and the quarantine hotels are also in tight supply. So there is merit to suspend this circuit breaker system. As to how many airlines are subject to this system, you can get information from the web. To respond to your question, we are monitoring how the COVID is playing out in terms of admission, and also COVID-positive patients number has increased. We do have sufficient isolation beds for the patients in public hospitals. At our HA meetings each day, we would have regard to the development of the pandemic. If the pandemic is taking a turn for the worse, we do have plans to mobilize the beds, and we can mobilize the beds to admit patients at short notice. As I said a moment ago, the members of the public should be cautious about the situation. If they haven't got inoculated, they should, and they should observe all the hygiene protocol as well. Lady at the back in black jacket. Cable news. That the circuit breaker system has been suspended. How would the CHP look at this in terms of the pandemic? And what is the prevalent strain? Is it currently in Hong Kong? And also the mainland doctor exchange program, is it going to be started in the QEH? And how many mainland doctors will be involved, and how soon will they be arriving in Hong Kong? What department will they be working in? And will there be similar programs for nurses and TCM? Now, for the circuit breaker system, the press release has set out the details. I don't propose to repeat them. Now, for the prevalence strain, it is BA.2.12.1, 97 or 98%, and 1% is actually suspected to be BA.2.12.1, about 1% are BA.4, BA.5 cases. Right, on the part of the HA, we are liaising with various departments about the exchange program involving doctors from the GBA. This is intended to enhance the exchanges among doctors and enhance the professional service. And ultimately, this would be beneficial to the patients. We are drawing up a detailed plan. Once this is in place, we will bring you up to date. Next, please. Last but one row, the lady over there, please. Mingpao Daily. About the flight circuit breaker system, since June 15th, how many cases are picked up at the airport, and how many cases are picked up on day 5 or day 7? How many were picked up after they've left the quarantine hotel? Now, for the HA, can you give us the age range of those who are in hospital and the vaccination situation? And Nethersoul Hospital, there are some staff members who come down with COVID. Do you think that the cases in the medicine department, has it got anything to do with the catering department? Also, Yinghua College, what sort of strains did they suffer from? Was it BA.4, BA.5? For the classes that are involved, what is the route of transmission? Why is there such an outbreak? Did they share the use of any facilities? Are they suffering the infection from the same source? Right? You asked for really minute details. But I don't have such minute details with me about the cases since mid-June. But today, 172 imported cases, 57% or so are picked up from the airport, and 90% of the cases picked up from are picked up from the airport and the quarantine hotel. 19% of them have left the quarantine hotel, but the CT value in the majority of the cases are pretty high. They are re-positive cases. They're not really transmissive. For the Yinghua College, cluster. We haven't seen any mutant strain pending PCR test and the analysis. We will monitor the genome sequencing analysis there. And on June 30th, or before they had lunch at school, some were having lunch together, and there were some contacts. And it's been quite a bit of time since. This week, they don't have lunch at school anymore because it is exam time and they are having half-day school. As at July 7th, at the North Lantau ICC and other hospitals, the age range is 1 and 104. 70% of the patients are 65 and above, 30% are below 65. And from our computer system, we get to see the inoculation status of the patients, although we don't have the statistics with us regarding the inoculation. Maybe I didn't make myself sufficiently clear. At the Alice Nethersole Hospital in the medicine ward, there are 4 staff members who got infected with COVID. Now, for this medicine ward, and also the catering department earlier reported, we are still investigating the link, and we are really concerned about any outbreaks to establish the link between them. The last row lady over there. RTHK. In July, August, this is the peak for the students to come back. What is the risk of suspending the circuit breaker system? And what is the proportion of these return students among the infected patients? I don't have the proportion there as such. Now, for the imported cases today, for example, a lot of them come back from the UK and the US, and they include some of the students there as well. For the imported cases, they about less than 10% of the overall scheme of things. The circuit breaker system probably doesn't play a significant role in stopping these cases.
I'm from Hong Kong 01. And you say there's an increase in number of cases involving BA.4 and 0.5. Is there a need to adjust the importation of cases policy? Now, if there's an increase in the percentage of BA.4 and BA.5 cases, then are the current measures effective in preventing an outbreak? And then could you take this opportunity to reduce the number of quarantine days at hotels? Now, you say that if the epidemic worsens, then public hospital services will be affected. So where are we now, and at what stage would hospital services be affected? And are we far from that stage? For BA.4 and 0.5, well, these cases, BA.4, 0.5 cases are highly transmissible. So if you have any symptoms, you should take a test as soon as possible. And then you could be isolated early and prevent from avoid spreading the diseases to others. Now, for day 3 sample, if we could do an additional PCR test on day 3, then we could do more data analysis, and then maybe we'll be able to identify more infected cases earlier. On the epidemic situation, we are closely monitoring the situation every day. If there are more people in hospitals, or if there are more confirmed cases, then we will see whether there is need to make any adjustment to existing services. For the time being, say some non-emergency day examination services or X-ray services, imaging services, and so on, there may be some adjustment. But then on the whole, if COVID patients have any particular needs, we take that very seriously. That's why we're closely monitoring the situation. Sorry, if I may clarify a bit. For the Alice Nethersole Hospital, there are 2 clusters. Let me clarify the number of staff members infected, 4 in the catering department. And the figure just announced involves a nurse in the medicine ward. Sorry, you asked about vaccines, and WHO, on the basis of its information, stated that vaccine may not be very effective in preventing infection compared to vaccines for other viruses. But then it could prevent serious cases. There's high efficacy there. So there is an obvious difference between those who've been infected and who have not, because with vaccination we can prevent serious cases. I'm from TVB. Just now, Dr. Kwan mentioned that for the Greater Bay Area Doctors Exchange scheme, the details are still being worked out. So what is the progress? Because from reports we see that in 3 months, 10 mainland doctors will practice at the Queen Elizabeth Hospital for a year. So what is the latest progress? How come the number is 10, and which hospitals do they come from, and which specialties are they in? And then some have said that 1 year is probably not enough. So would you explore further the length of the exchange period? Thank you. Now for the exchange scheme, we have in mind the doctors in the 3A hospitals in Greater Bay Area. They are experienced doctors, and they've been to Hong Kong to give us support during the 5th wave of the epidemic. And on the actual number of doctors and where they will go, we are still in discussion with the department. So when details are available, they will be announced. Thank you. Over there, please. I'm from Orange News. Now, for what we've seen an increase in number of cases and number of cases involving variant strains. There are over 3,000 cases. So how would you assess the current trend? Are you seeing any worsening of the 5th wave of the epidemic? And for the King Folk home for the elderly, so was it residents or staff members who first got infected, and what was the onset date? And what is the transmission channel in the homes for the elderly? Well, we're seeing an increasing trend. Probably in another week or 2, the figures may double. So if this trend continues, then in another 2 weeks, there's a possibility that the number may double. So we will be back to a higher level of cases. That's why we must all be very careful as to which wave you call it. Really, it's just a name. I don't think we should, dwell on that. For King Folk Home for the Aged, there are 2 residents and 1 worker who've been infected. It's hard to tell who's the source or index patient in this case. Then, at homes, care services are involved. So it's possible that for residents staying in the same home, they have a high chance of getting infected. That's why vaccination is very important. Because there is an outbreak here at this home, so we will. That means all other residents have to be quarantined. Last question from the lady over there, please. I'm from the Hong Kong Economic Times. Now, you say that the number of confirmed cases may go up to a high level in the next 2 weeks. So do you have any estimate on the number? Would it be over 10,000 cases like before? And then if you cancel the circuit breakers mechanism now, are you worried that it may send out the wrong signal? And then are there measures to prevent cases from going back to a high level? For BA 2.1, 2.1 cases, for untraceable cases, where do those people stay, and which clusters are involved? And then now about mainland doctors coming to practice in Hong Kong. Well, what language would the doctors use to communicate with patients? Are you concerned that there may be communication barriers? or it's hard for us to guess what the number may be. But if you look at past trends, say in the past few weeks, if this is the rate of increase, then in another 2 weeks it's possible that the number may hit 6,000. So then there will be some pressure on our hospital healthcare services. As for anti-epidemic measures, the government will consider the overall situation. As for BA 2.1, 2.1 cases, they are spread all over the territory. Some cases are in Hin King Estate, some in Fanling, Yonghua Quad, and then Discovery Park, Chun Wan, and then Tai Po, and then Lei Yumun Road, Lei Yan Court, Kowloon, Yu Fei Building, and then Conduit Road, Yun Long, Shui Mei in Kam Tin, Tin Shui Wai, Tin Shui Road, Tin Hang Estate, Hang Fu House. So it's everywhere, So that's why I will not read out the full list of addresses. For the fifth wave of the epidemic, when the mainland support team came to help us out, there were colleagues who could speak Cantonese because these colleagues are actually from the Greater Bay Area. So we don't see any major problems with communication with patients. And then, as I mentioned earlier, we're still working out the details of the scheme. If there is any new information, we will report to you again. Thank you. That's the end of the press briefing. Thank you.